Hi, I'm Lynn Miranda, Provost here at the University of Notre Dame. I'm really happy to be talking to you today about surveillance testing. Surveillance testing is a funny term. It sounds like some sort of creepy CIA thing, but really surveillance testing is a term that comes out of the public health community. And by surveillance testing, what we mean is trying to get a handle on where a particular infection or where a particular problem is occurring. So for example, we do a lot of surveillance testing in childhood lead exposure. We want to figure out which are the houses that are more likely to expose kids to lead, and we want to get the kids out of those houses or get those houses fixed up. That's one form of surveillance testing in public health. Another form of surveillance testing is what we're doing here on campus now, and that's surveillance testing around COVID-19. In the same way, we want to get a handle on where the virus is spreading, get people who have the virus out of the congregate living situations, get them into isolation as quickly as possible so that we can prevent the spread of the coronavirus across the entire campus and keep all of us here in person, learning together and in community together. An important thing to know about surveillance testing is it's not an invitation, it is a calling. So when we call you to come to surveillance testing, we need you to show up. It is absolutely critical for us to be able to maintain our time together here on campus for everybody to show up for surveillance testing. We've been doing surveillance testing for a while here at the university. We did pre-matriculation testing, that was a form of surveillance testing, and we've been running surveillance testing out of the football stadium for a number of weeks now. We're doing about 400 surveillance tests a day out of the football stadium, and starting next week, we're hoping to ramp that number up to almost 1,000 tests a day. So how do we decide who we call in for surveillance testing? We're using a random sampling approach. That means that for faculty, staff, undergraduate students, and graduate students, we create random samples for each of these groups. So let me start with undergraduate students as an example. So I have all the undergraduate students. I take out the students who are learning remotely. I take out the students who have already been diagnosed with COVID-19. And then I take the rest of the students and I randomly arrange them. And then I go through from the top of that list. So if I'm calling in 400 people for surveillance testing amongst the undergraduate students, I take the top 400, and then the next day the next 400, and the next day the next 400. Every now and then we elevate people in the testing process. So for example, we had a dorm where there were a lot of cases, so we pulled some people up who were lower down in the list, we pulled them up. We had another dorm where there were a lot of cases, and in that instance, it felt warranted to go ahead and test everybody in the dorm. We had one instance where we went ahead and tested every student in a particular class because we wanted to make sure there weren't any signs of classroom transmission. And that's really important for us to be able to stay here together in person, learning together. We have been doing nasal swabs for surveillance testing. Starting next week, we'll be doing saliva testing. When you get called for surveillance testing, please show up. It's very important, and there are disciplinary consequences if you don't show up. There are 5 things to remember. Wear your mask, maintain physical distancing, wash your hands often, fill out your daily health check, and show up for surveillance testing. Those 5 things, easy to remember, you got 5 fingers. Those 5 things will help keep us here together.